Good morning to the Board of Directors and the CEO. I would like to introduce myself. My name is Samantha and my group and I would like to acknowledge the traditional owners. In keeping with the spirit of reconciliation, I acknowledge the traditional owners on the land where this hospital now stands, and I recognise that these have always been places of teaching, healing and learning. We wish to pay respect to our elders, past, present and emerging, and acknowledge the important role the Aboriginal and Torres Strait Islander people continue to play within the community. Within the group, first, Julie will be discussing the holistic care within the Aboriginal and Torres Strait Islanders. Secondly, Spencer will be exploring the Aboriginal community-controlled healthcare system. Then Yui will be talking about the interdisciplinary collaborative, and I will be talking about Dharma, and finally Chucks will be talking about
Good morning, my name is Julie and I'm going to discuss the barriers that prevent our current health system from meeting the holistic health needs of Aboriginal and Torres Strait Islander peoples. There are many barriers that contribute to the holistic needs of Aboriginal and Torres Strait Islander people. Throughout history, health services have either been inappropriate or non-existent for Aboriginal and Torres Strait Islander people. Cultural barriers in healthcare are hurdles that individuals face. Some examples of these barriers are language, conceptions of sexuality and gender, and medical procedures and practices. These barriers lead to unsatisfactory outcome of health services due to miscommunication because of the difference in cultural backgrounds between both parties. Further identified barriers are financial, geographical, cultural and personal, such as unemployment and education. Unconscious discrimination can be due to institutionalised racism by services which then result in patients not receiving adequate treatment. There is a large gap between Aboriginal and Torres Strait Islander people and non-Indigenous Australians in accessing the health system for care with treatment that should be there for all of us equally. Social determinants lead to health inequalities that cause barriers in accessing healthcare services. Social determinants include shortages of medical services, practitioners and Aboriginal health workers in urban areas, but particularly in remote regions. There is a lack of affordable healthcare, lack of awareness of Aboriginal doctors and nurses. For communities in remote areas, the distance to travel, the lack of affordable travel, staying away from home without the family's support and increased financial costs can be extremely concerning. Considering that language is the main part of the culture, communication that is not effective can lead to failure in the outcome of healthcare. If healthcare staff fail to communicate properly, our well-developed healthcare system will provide little benefit to the patient. Effective cultural communication will result in quality healthcare as well as far less misunderstanding. With more effort placed on cultural communication between Indigenous clients and healthcare workers, this will reduce the risk of inappropriate interventions and even misdiagnosis. History cannot be rewritten and we cannot undo the wrongs of the past, but we can do all we can to recognise racism and establish a zero tolerance to it. We must ensure easy access to services for all communities and individuals. Closing the gap should be taken seriously, allowing Aboriginal and Torres Strait Islander people to manage their desired health care and, above all, respecting their choices. This could lead to a fairer and safer health outcome for Aboriginal and Torres Strait Islander people. I now wish to hand over to Spencer to talk about Aboriginal community-controlled health services.
Pioneered at Redfern, Sydney in 1971, the first health service to offer primary health care to the Aboriginal community was opened and named Aboriginal Medical Services. Originally funded solely by donation, Aboriginal medical services were quickly granted government funding in aid to reduce health disparities between the Indigenous and non-Indigenous population. Although relatively few Aboriginal medical services are still in existence, Aboriginal community-controlled health services providing comprehensive primary healthcare account for the majority of health services providing healthcare to the Indigenous population. Aboriginal community-controlled health services have proliferated to over 150 throughout Australia, which was supported by the World Health Organization's Declaration of Alma Ata in 1978, acknowledging primary healthcare as a fundamental element to the attainment of health for all. The establishment of Aboriginal medical services and later Aboriginal community-controlled health services were aided by the World Health Organization's visit to Brisbane in 1967, which produced and published a damning report condemning the atrocious health condition of the Aboriginal people. leading to a national and international recognition. Developed in America, community control was based on the principle of self-determination, which allows the local Aboriginal community to take control of their own destiny, with protocols and procedures determined by the community which it serves. Aboriginal Community Control Health Services are governed locally by an elected board, with most elected from the Indigenous population. Each Aboriginal Community Control Health Service works autonomously and independently of each other, with representation at state, territory and nationally by the National Aboriginal Community Control Health Organisation. With over 150 Aboriginal Community Control Health Services across Australia, whether rural, remote or very remote, access to comprehensive holistic primary healthcare has become more accessible. Each Aboriginal Community Control Health Service offers bulk billing, access to transport facilities and reduces complexities normally associated within the Australian mainstream healthcare system. To ensure delivery of culturally appropriate primary healthcare, Aboriginal Community Control Health Services have over 6,000 employees, with over 50% of the workforce identified as Aboriginal or Torres Strait Islander. Another aspect adopted by the Aboriginal Community Control Health Services to assist in the delivery of culturally safe healthcare is the interconnectedness of both biomedical and traditional bush medicine practices. With over 3 million presentations each year and an annual increase of 8%, community control has not only provided health and well-being through its primary healthcare service delivery model, they have also improved community health and well-being through challenging Indigenous social detriments such as employment and education. I stumbled there a few times. Pioneered at Redfern, Sydney in 1971, the first health service to offer primary healthcare to the Aboriginal community was opened and named Aboriginal Medical Services. Originally funded solely by donations, Aboriginal Medical Services were quickly granted government funding in aid to reduce health disparities between the Indigenous and non-Indigenous population. Although relatively few Aboriginal medical services are still in existence, Aboriginal Community Control Health Services provide comprehensive primary health care, account for the majority of health services providing health care to the Indigenous population. Aboriginal Community Control Health Services have proliferated to over 150 throughout Australia, which was supported by the World Health Organization's Declaration of Alma Ata in 1978, acknowledging primary health care as a fundamental element to the attainment of health for all. The establishment of Aboriginal
Hi, my name is Yue Yi. My topic is about interdisciplinary collaboration and Indigenous health workers. An Aboriginal and Torres Strait Islander health worker is an Indigenous person who holds a minimum qualification in primary care or clinical practice. This role supports numerous health practitioners, typically in cultural support roles. However, it is increasingly a clinical support role. The major part of their job is to work as a cultural broker, bridging the gap between Indigenous people and contemporary Australian health services. Their strengths are, firstly, as cultural brokers, they are more culturally safe and can provide guidance about cultural differences for non-Indigenous employees. Secondly, Indigenous health workers can help build better rapport with Indigenous clients and better advocate on behalf of them, because they are usually members of the local community with a knowledge about the community and social relationships. In addition, most Indigenous health workers are unregulated health workers. It's cheaper to hire more of them, which can optimize the capacity of a health workforce in the remote regions. So nurses can focus on patients with higher care needs and achieve better health outcomes in that area. However, there are some limitations. Firstly, delegating tasks which are considered simple to Indigenous health workers are quite common, which can result in conflict in workforce and make them feel undervalued and uncertain about their career development. Also, sometimes their roles are not understood or clarified. Nurses have reported uncertainty about the role and the capacity of Indigenous health workers. Additionally, racial discrimination is quite common in the workforce. Disagreements between nurses and Indigenous health workers can be considered as racism. To optimize each other's role, nurses need to have a better understanding of the roles of Indigenous health workers and build a partnership of mutual respect and trust. Furthermore, more training needs to be provided for Indigenous health workers. Last but not least, cultural safety should still remain the responsibility of all health professionals. Let's hand it over to Sam for Dharma.
Dharma, also known as discharge against medical advice, sometimes also known as self-discharge. This happens when an inpatient leaves the hospital against the advice of the medical treating team. Aboriginals and Torres Strait Islander people are 7 times more likely to self-discharge than non-Indigenous people. Discharge against medical advice represents a problematic issue within the healthcare setting for both patients and healthcare providers. Even though it's acknowledged that Aboriginals and Torres Strait Islander people have poorer healthcare access and health outcomes than non-Indigenous people, resulting in the higher admissions rate, longer inpatient stays. This is then made worse by the choice made to leave the hospital against the advice of the medical treating team. Factors that lead to Dharma can go from gender, age, personal circumstances, the historical factors, the cultural issues, hospital level factors, social disadvantage, community level factors, communication issues, isolation. The other reasons why patients self-discharge include isolation, fear, the miscommunication, the breakdown of patient-doctor relationship, the stigma, sometimes family responsibility, or the fact that they're just bored. Premature discharge and subsequent readmission to hospital significantly disrupts the patient's continuity of care and is crucial for effective treatment and improved health outcomes. One health improvement strategy would be to increase cultural competency with the use of Aboriginal liaison officers. Being culturally competent means that health professionals have the ability to interact effectively with people of a different culture. Cultural competence training for health professionals would greatly benefit the Aboriginal and Torres Strait Islander people and reduce the rate of Dharma, alongside with the use of Aboriginal staff, and especially the Aboriginal liaison officer and Aboriginal healthcare workers. The roles of Aboriginal liaison officers and Aboriginal healthcare workers is to provide emotional support, social and cultural support to the patient. It's also to educate the staff members about the culture and help guide staff members to make the stay within the healthcare setting better for the patient. With equipping healthcare workers with the greater awareness of Aboriginal and Torres Strait Islander culture, the healthcare professionals should be able to reduce the cases of discharge against medical advice by reducing the racism and prejudice that comes from the hospital experience of the Aboriginal and Torres Strait Islander people. I would like to now hand over to Chuck, who's speaking about the political well-being of Aboriginals.
My name is Chuk Subadra, and I will be talking about the political imperative of well-being. First, political imperative of well-being of the Australian First People implies the importance of the effect and impact of historical and current policies on the well-being of Australian First People. First, it's important that we know that it's important we know the history of colonization and certain colonial policies throughout that history and how it currently affects the health of Aboriginal and Torres Strait Islander people. While noting the importance of historical policies and their effect, it's important that nurses recognize how current policies can reenact these historical experiences today, thereby influencing the health outcomes of Australian First People in hospitals and health facilities. So why do nurses need to learn about this deficit within our justice system in their duty of care for Aboriginal and Torres Strait Islander people and become better advocates for Australian First People? The answer is because there's significant outcome of institutional racism which has extended towards the healthcare system. Now we need to talk about the meaning of advocacy in nursing. What is an advocate? An advocate is one who pleads or calls for justice or mercy. An advocate is described as a person who specializes in one's aid and cause of court of justice. Patient advocacy is important, especially those of Australian First People, in order to safeguard and contribute positively to their self-determination. It's also important that nurses know that Aboriginal and Torres Strait Islander people's well-being is aligned with social justice. The more nurses are aware of historical as well as contemporary social justice matters, the more informed we will be, and the more effective we can be better advocates for Australians First people. First, nurses need to become better advocates by knowing the importance of cultural safety, as well as the roles of social commissioner for Australian First people. And these roles include advocating for the rights of Indigenous people, promoting Indigenous perspective on different issues, building support and understanding for Indigenous perspective, and empower Indigenous people. As currently, the social commissioner is June Oscar. Nurses are supposed to put forward their concerns and liaise with June Oscar about the negligence in the respect to human rights of the Australian First people in hospitals and aged care facilities, and as this is the best medium of voicing their concerns to the Australian government.
We'd like to thank you for your time and thank you for watching.